All right, team. The patient presents with symptoms of epoxygenase, pyomyositis, and bronchitis. Let's figure out what's going on here.
Could it be endometriosis? Those symptoms align with it?
I'm leaning towards tuberculosis, especially with the pyomyositis. It's a common infection associated with TB.
I think it might be something related to the lungs. Maybe pneumothorax.
No.
Evacuation of blood in the chest cavity.
We need to act fast. All of you, we have to perform a bowel resection immediately.
But Dr. Hawks, that's such a risky procedure.
Are you sure that's the right course of action?
I don't know if we should go that far, Hawks.
I don't give a damn how risky it is. It's the only way to save this patient's life. Get ready. We're going in for the surgery. Tracy, I want to discuss performing a bowel resection on my patient with catamenial pneumothorax.
Hawks, are you sure that's the right course of action? It seems like a risky move.
I've been practicing medicine for over 20 years, Tracy. I know what I'm doing.
I understand your experience, Hawks, but we need to consider all options before proceeding with such a major surgery.
Don't question my expertise, Tracy. I know this patient's condition better than anyone. Bowel resection is the best chance we have.
I'm not questioning your expertise, Hawks. I just want to make sure we explore all possibilities to ensure the best outcome for the patient.
I don't have time for doubts, Tracy. This is the right decision, and I'm going to move forward with the surgery.
Hawks, I'm your boss, and I have to approve any major procedures. Let's work together to make sure we're making the best choice for the patient.
Son of a bitch.
Fuck. You all nearly killed our patient. Unbelievable!
We thought we had the right diagnosis and procedure, Hawks. It was a difficult case.
I still believe we were on the right track. It was a complicated situation.
I have to agree with Kelly. I stand by our original diagnosis.
Stand by it. You should be hanging your heads in shame. You are a disgrace to this hospital. You call yourselves diagnostic doctors. You're a bunch of amateurs.
We did the best we could with the information we had, Hawks.
The best would have been to actually get it right. Instead, you chose the wrong bowel resection area, for God's sake. Are you all blind as well as stupid?
We will learn from this, Hawks. Mistakes happen in medicine.
Mistakes that cost lives, Kelly. I won't have incompetence like this in my team. I'm done with all of you. Get out of my sight.
But Hawks.
Out. Now. I can't believe I still haven't figured out what's wrong with patient X.
Maybe you should try checking their vitals again, or running more tests.
Oh, thanks for the groundbreaking advice, Johnson. I'll get right on that.
Hey, just trying to help, Hawks.
Wait a minute. I think I know what it is. I have to go, Johnson. As for the suggestions.
Wait, what? Hawks? You can't just leave me hanging like that. What did you figure out?
It's walking away, you'll see soon enough, Johnson. Good luck with the rest of your shift. Chat completion message. Content, I got it all figured out. Forget catamenial pneumothorax, it's pathogen.
Hawks, what are you doing? You can't just barge in here without proper gear.
This is a serious operation. We can't afford to make mistakes.
Trust me on this one. Catamenial pneumothorax doesn't fit the bill.
Hawks. We can't just switch diagnoses like that. It's risky. Road assistant function calls are none. Tool calls are none.
I can't believe you doubted me, Tracy. I knew from the beginning what was wrong with the patient.
But Hawks, the wrong diagnosis could have cost the patient their life. It's my responsibility to double check.
If you had just trusted me, we wouldn't have been in this mess. You need to learn to listen.
Listen, you're the one who needs to listen, Hawks. We are a team and we need to communicate effectively.
I communicated just fine. It's your ego that's getting in the way of patient care.
My ego. You're the one who's always trying to prove yourself. Maybe it's time for some self-reflection, Hawks.
I don't need to reflect on anything. I know what I'm doing. Maybe it's time you start trusting me and stop second guessing every decision I make.